You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
Hello and welcome to today's episode of the DOCtalk Show. And in today's episode, we are going to dive into a discussion about something that's very important to every Ugandan life: emergency medical services. Whether it's an sudden illness or a road traffic accident, timely and coordinated emergency care can be the difference between life and death. And today we are speaking to the very people that are working to strengthen this system across the country. Today with me in the studio, we have Dr. JB, who is the Commissioner of Emergency Medical Services. Welcome, Dr. JB. I'll ask you to introduce yourself again for the audience.
This is Dr. John Baptist Waniaye. I'm the Commissioner of Emergency Medical Services.
Welcome. I'm honored to be hosting this episode, which is touching on a very important subject. So we are going to kick off with understanding what emergency medical services are all about. And I'll welcome our Commissioner, Dr. JB, to tell us what is EMS and why is it important.
Yeah, thank you, Dr. Kamara. EMS is Emergency Medical Services. And emergency medical service refers to that subset of the healthcare system which is responsible for improving care for acute illnesses, acute injury, obstetric emergencies, trauma, mental illnesses, all those conditions which present as emergencies. This is the system that responds to it. And this system is established at 3 levels. We establish a responsive system at the scene where the injury or the emergency has occurred. It could be like in this place, it could be in an office, it could be on the road, it could be in a home, anywhere where the emergency has occurred, we call it a scene. And that is the first response which you give. Then the second area is when you have called in a professional team, and we call these responders. Usually they may come on an ambulance or they just come using any means, but they will reach and ensure that you are transported with care to the next facility. And an organized care system is the National Ambulance Service. That is transportation with care. The third component is at the health facility level. Even if you receive the care at the scene, care during transportation, if you reached a health facility at the accident and the emergency unit and they are not prepared for you, then it can be a problem. So those 3 levels: care at the scene, care during transportation, and care at a health facility level, the immediate care, that is what we describe as the emergency medical service system.
Thank you. And what is the emergency care system like at the moment? Would like to look at the past and the current emergency medical care structure. How do you relate the two?
The current EMS system, we started developing it in 2016. In 2015, before the visit of then the Pope, government of Uganda was required to have a functional emergency medical service system in order to host. So the first take was to establish a simple ambulance system, and it began with setting up 10 ambulances for the response. Later in 2016, the thinking of the current system started by establishing the Uganda National Ambulance Unit. That unit stayed for about 1 year, and in 2017, the Ministry of Health, with the approval of Cabinet, decided to establish a Department of Emergency Medical Services. And that is when I was recruited as a commissioner for that department. From then on, we developed the policy and developed the structures for the EMS system across the country. Right now, we do have the Department of Emergency Medical Services at the Ministry of Health, very well streamlined. We have a regional EMS structure, and we also have district EMS structures. Also at health facility level, we have tried to realign and bring into the structure emergency care responders. And we do have on the structure, like you see, Mulago established accident and emergency division. All the regional referral hospitals have a department of emergency medicine. They also have an arm called regional ambulance system. We do have on it attached the marine and aeromedical service, and also at the district level, we established at county level an ambulance response system. So that is currently the system which the structure which we have set up across the country. And in 2023 and 24, this structure, the staffing structures for these levels were approved by the Ministry of Public Service.
So a lot has been done in the structure, we can see. Now, how for policy, how far have we gone in terms of policy?
In 2021, the Cabinet of Uganda approved the Emergency Medical Services Policy. That policy outlined the areas in which we were to make the investments within the country. And we have since then progressed in various areas. I will outline a few of them. We have established the staffing structure, like I've already mentioned, at almost all levels. And now we are trying to mobilize funds to make sure that we train people and we also recruit them to be in the public service space. We have reorganized because the policy requires us to develop the accident and the emergency units across the country. These have been reorganized, and some of the hospitals now have standard accident and emergency units. We have also set up we call regional call and dispatch centers. The target under the National Development Plan 3 was to establish 12 regional call and dispatch centers. But we have managed to establish 9 of them across the country. Also in the policy, we were required to have standard ambulances. You know, by 2016, this country did not have standard ambulances. It was only the Uganda Heart Institute which had one standard ambulance. The rest of the ambulances, we were using double cabins, and we used to call them ambulances, where sometimes if you are taking a patient, you need a nurse or whoever is on could carry the drip for moving the patient. So currently we have 287 standard ambulances, and that meets that structural component. We have also worked with the Ministry of Works and Transport to establish the components of emergency response to road traffic injuries under the Traffic and Road Safety Act, and the 123A and B requires that we should have first responders on our roads, and people should be able to offer care if you find an accident victim, and when you reach the police station, you should not have a case to answer. Thank you.
Wow, we've come so far from 2016 and from 10 years ago. There is an issue you've mentioned about traffic and road accidents. Concerning traffic, road accidents, I'm wondering whether we've have anything in terms of policy that's looking to help us with maybe creating lanes for emergency vehicles, for ambulances, because we have this problem on our roads. So I'm wondering, is there anything that we have in line?
Thank you, Dr. Kamara. We have had various discussions with Ministry of Works and Transport. There is an organized committee there, which is multi-sectorial in nature, which brings us all the ministries together, and that in road safety management, we presented the need to establish the ambulance lanes on the road, but that has not yet been realized. The area which we are focusing on now is to make sure that the roads are wide enough and there is awareness for people to give way for the ambulances to be able to move. Because in the Traffic and Road Safety Act 2020 as amended, we have a right of way for ambulances.
Okay, thank you for that structure, for that overview on the emergency medical services structure or the emergency medical care structure in Uganda, past and present. We are going to take a short break now, but we shall be back. Please stay with us for this important conversation.
This message is from the Ministry of Health with support from partners.
Since 2015, Quiz Malie production has been at the forefront of media innovation. Our passion for storytelling and creativity has driven us to deliver over 100 successful projects, making a lasting impact on the industry. With 4 highly acclaimed TV shows, we've become a household name, bringing quality content to your screens. At Quiz Malie Production, we specialize in content creation, digital media marketing, media buying and documentaries. We plan corporate events, provide top-notch photography and videography services, and offer seamless translations and live streams for your every need. Join the hundreds of satisfied clients who trust us to bring their visions to life. Quiz Malie Production, your partner in media excellence. Visit us at Quiz Malie and let's create something amazing together.
You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
Hello and welcome back to the DOCtalk Show. My name is Dr. Kamara Ivan, and in this episode, we are discussing a very important matter that touches on the lives of every Ugandan, and that is emergency medical services. With me here in the studio, I have Dr. JB, who is the Commissioner, Emergency Medical Services, Uganda. So earlier in the show, we had talked about the emergency medical care structure, and now we are going to talk about something else. So currently, the second East African Symposium and Expo on Trauma, Injuries and Emergency Care is going to take place from the 7th to the 8th of August. And we are going to ask Dr. JB to shed some light on this event. What is this event about? Which countries are involved? And why is it important that we should come together to have this conversation on trauma, injuries, and emergency care?
Good. Thank you, Dr. Kamara. The second East African Symposium and Expo on Trauma, Injuries, and Emergency Care has been planned for the East African region. And in it, we are going to have participation of Uganda as a host country, Kenya, Rwanda, and Tanzania. This symposium is aimed at showing the burden of trauma and injuries in the country, and what are we able to do, what have we developed, what responses are there. And it's important for us as East African community to work together because some of the policies and the responses, we need them to be synchronized so that they meet the international standards. In this symposium, we are going to have the participation of our dear Permanent Secretary, Dr. Diana Atwine, who will be the chief guest to this event. And there will be a lot of sharing in terms of policy and response. Thank you.
Thank you. So I myself happen to work in one of the busiest emergency departments in the country at Mulago Hospital, and I'm just wondering, so how can professionals like myself, students, and the public benefit from this symposium and expo that's going to take place?
There will be a lot of sharing. There will be discussions, academic presentations, policy presentations, and sharing from stakeholders. So there will be a lot of learning, which all of us are going to benefit from this symposium. Also, the actors, the service providers in the emergency care space are going to showcase what has been done, and we think that many of us will learn how we can utilize what is available within the country. The general public will also learn how to access services in the emergency services when you need them and when you have an emergency. Thank you.
We need to build trust, public trust in the emergency medical services. I agree with that. So can you share some of the innovations or strategies or training that will be shared during this symposium and expo?
There has been trainings taking place in this country, trainings in basic life support, basic emergency care, advanced life support. All this is going to be shared during that space. And there has also been research in the emergency care space. These papers will also be shared during that period. We have also, as part of the policy development, we have been discussing with the Ministry of Education and Sports to establish emergency care courses, professional. The first to be established was emergency medicine in Mbarara University of Science and Technology. I think now we are in the fourth or fifth year since it was set up. It started in 2018. Makerere University College of Health Sciences also in 2018 started that course up to date. The advantage then is that we have been able, through sponsorships of Ministry of Health and others, to have 21 emergency medicine physicians qualify from these institutions. In 2022, we also have had this course start at Uganda Matters University, Zambia campus. Another progressive thing is that we have been able to start the paramedical courses. The certificate courses started in Lubaga, and this year you saw the First Lady and Minister of Education, Mama Janeti, launched the first diploma course for Uganda in Jinja, and the training is going to start from Rubaga Health Training School, also in Guru College of Health Sciences, and also at Zambia Health Training School, and many others. The other thing I would like to highlight is that we have been able to get sponsorships for these programs. Seed Global Health is supporting us to have 120 emergency medicine physicians trained in this country within the next 5 years. Global Emergency Care is supporting us to have 60 emergency medicine technicians trained in this country. So those are some of the things which will be able to be shared in the symposium. Thank you.
Thank you, Dr. JB. And more on what is on the ground, the reality on the ground. Yes, I know I'm also a part of the reality on the ground, being one person that's also training in emergency care. However, from your perspective, what do you think is the reality on the ground? What are the gaps that exist on the ground that you're working to sort?
When you view our dream state, we are not yet there. We are establishing all these structures, but the eventuality is that we must be able to respond to that patient who requires our care in time and be able to save a life. Uh, we have trained first responders in some regions, but majority of the regions we do not yet have first responders. When someone gets an accident, say on the road, the first people who are reaching are usually not trained people. You saw even an example when we had one of our doctors get an accident and was transferred to Kiriandongo. That doctor, if we had a system well established, then care should have been given at the scene during transportation, and that would have limited the complications which he got and which he eventually passed on. That tells you the gaps in the system. And then the funding for this, the emergency care, is still a limitation. We have trained emergency medicine physicians and paramedicals, but we haven't yet absorbed them in the system. We have, I think, only absorbed about 4 of them. So we need to absorb these people in order for them to change the trajectory in emergency care. We still also have a gap. As I talked about standard ambulances, we have covered 60% of the country with those standards, but 40% is still uncovered. And also we don't have yet a universal access number. Our plan is to have 912 because the total numbers which we are using now are 10 to 13 figures. Remembering them even to a highly educated person is not easy. So that's why we are saying we must have 912 functional so that even my mother there in the village, when you say 912, Mwenda Emubiri, then she will be able to remember and make that phone call for our response. This we are working hard. The PS has supported this system, and I think from September to December, we are starting to put this into function. Thank you.
Thank you, Dr. JB. So a lot is being done. Nonetheless, there are gaps here and there, unfortunately, but it's good to hear that all these gaps are being worked on here and there. The bystanders, many bystanders are afraid of partaking, maybe as trying to assist when they encounter an emergency. And I'm glad that you said that that is being put into consideration. The bystander contribution to emergencies, training of the first responders whom we've seen 90%, it will be either the police or the border motorists, and those need training. So we are going to take a short break and we'll be back with the DOCtalk Show. Please stay with us and continue to have this conversation with us.
You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
Doreen Okong Alaleit are my names. I'm an emergency physician. I work at Mulago National Specialized Hospital. I work with Makerere University College of Health Sciences, where I mentor, I teach, I supervise postgraduate students and undergraduate students in the discipline of emergency medicine. Emergency medicine is a new specialty in the field of medicine. It's been there for less than 50 years, of which some might think it's a long time, but internationally it's a new discipline. In Uganda, the first training institution was Kamara University, which opened in 2017, followed by Makerere University that opened in 2018. What emergency medicine physicians do is that we offer critical care, specialized care to the emergency patient. So we manage all sorts of patients. We manage the adult patient. We manage the pediatric patient. Those are the children. We also manage the elderly patients, but we manage them at a time where there are medical emergencies between life and death. So what we do is we offer resuscitative medicine to those that present in any sort of emergency. It could be a trauma emergency from an accident, a fall, a crash. It could be a medical emergency, for example, hypertensive crisis, or it could be a diabetic emergency. It could be a psychiatric emergency, etc., etc. That is what we do. I am also the president of the Emergency Care Association of Uganda, and this is an association that encompasses all professionals from all walks of life, and not only the medical fraternity, but we bring people under the body of emergency care in Uganda. All those that are involved in all the aspects of the continuum of care. Now, the emergency medical systems is something that was adopted under the WHO, whereby we look at how a patient goes through the system as they receive emergency care. And that is the pre-hospital care, the in-hospital care, and then the disposition into the community. So you realize that there are different areas at which a person will go through the system. In the pre-hospital care, this is the time before they get to hospital. What happens when you're at home and you get an emergency? Who do you call? How do you get from home to an area of specialized care? It could be a hospital, it could be a health center, and so all that is a pre-hospital care system. Of course, there are elements of communication, of transportation, but there should be care as you move from where you get the emergency from until you get specialized medical treatment. In hospital, so this is within the hospital, there are different areas where you're going to receive emergency care. At the entry point of the hospital, that's the emergency department, but also within the theater, within the ICU, within the wards, you can still receive emergency care. As you leave these areas of emergency care, where do you go to? Do you go home? Do you go into a tertiary facility? Do you go into an inpatient ward where you're stable? Or do you end up in theater? Or do you end up in the critical area units? All that is part of the disposition. So the emergency care systems transitions all the way from the time someone gets an emergency until they receive the care in a specialized facility. And after they have been resuscitated, where do they go? So that is the emergency care system. The Emergency Care Association of Uganda, in collaboration with Ambulance Professionals of Uganda and the Triad Project under the School of Public Health, will be holding a trauma and injury symposium and that will be at the School of Public Health on the 7th and the 8th of August 2025. The Emergency Care Association of Uganda, in collaboration with our partners, that is the Ambulance Association Professionals of Uganda, as well as the Triad Project under the School of Public Health in Makerere University, is currently holding a trauma and injury symposium at the School of Public Health auditorium at the main campus grounds. We want to bring everybody that's involved in emergency care, but everybody that's involved in trauma and injury. We want to make sure that we prevent. We also want to make sure that we prepare ourselves, but we want to make sure that we can educate the general public and we put stakeholders on some sort of accountability. What are we doing to reduce the burden of trauma and injury in this country? What can we do better? Where can we help? What discussions can we have? We've lost so many people to trauma, to injury, not because we do not know what to do, but we do not have a system in place to prepare ourselves to care for these people that have had trauma and injury, but also we don't have a system in place to rehabilitate them. So let's hold all the stakeholders together. Let's ask ourselves difficult questions. Let's find answers. Let's create solutions that work for us Ugandans. Let's create solutions and let's create systems that work for a Ugandan system. Come and listen to very important discussions. Come and share your experience. Come and hear what could do better for your country, but also what could help you as an individual in regards to trauma and injury. This event is a 2-day event. It is happening at the School of Public Health Auditorium on Thursday and Friday, and it's going to be a very interactive session. It's going to be a very powerful session. We have very important keynote speakers. Our guest of honor is the Permanent Secretary of Health, Dr. Diana Twine, and we are going to have different professionals that are involved in emergency care, not only in Uganda, but across the region, from Kenya, from Tanzania, from Rwanda, from Burundi. As Ugandans, it's important that we lean not only on ourselves, but there are systems that are working across borders. Let's learn from them. Let's try and create a system for Ugandans and what solves Ugandan problems. But it doesn't mean that we shouldn't look and see what has been working in other countries. The burden of trauma and injury is very high in this country, and either me or you or your neighbor or anybody you know could be a victim to trauma and injury. So come one and come all. We need to advocate for more training in this country, especially in the field of emergency medicine. And this does not only apply to doctors, it applies to nurses, it applies to professionals on ambulances, it applies to different cadres in the healthcare system. There are trainings that are going on, but we can do better. We need to improve on the level of training. We need to make sure that we have skilled health workers who know how to offer care to an emergency patient in any situation. So if we impact and empower people with these skills, then they can go ahead to save lives. And there needs to be some sort of increase in training institutions, but also in the training packages, so that people can come and learn these skills and transfer these skills and put these skills into practice. There also needs to be some awareness in terms of community education, community first aid response, community healthcare systems that work for communities. We cannot wait and get to a point whereby there is an emergency in a village somewhere and community members do not know how to act. Emergencies happen all the time and they happen anywhere. So let's empower the community to understand what a medical emergency is and how they can respond and how they can call for help and where they can take this emergency patient. So community awareness, but also community response is important to improve emergency care in this country.
You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
Crafted with precision, Designed for brilliance, Supreme Wave pens reach the hands that shape tomorrow. Only a Supreme Wave delivers expression this pure. In every stroke, confidence flows. Because greatness isn't guessed, it's written. Supreme Wave, write your future.
Supreme Wave are the best!
You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
As the president for the Emergency Care Association of Uganda, I represent different cadres of healthcare professionals, but also different professionals that are involved in emergency care systems. There are so many challenges that emergency care providers face on a daily, especially in regards to offering emergency care to patients that are in need. Right from the time that someone realizes that they have a medical emergency, how do they recognize that it's a medical emergency? Who do they call? What number do they use? Where do they go? How do they get to that point where they shall receive specialized care? So, one of the challenges that we face is that we are at the end of a spectrum whereby most times people do not know what an emergency might look like. And so sometimes someone can come to you when it's a delayed time or when it's late in the emergency, which is very critical. In emergency medicine, there's something called a golden hour. When you get a medical emergency, time is very, very important. The earlier you get to a specialized center to receive critical interventions to improve your outcomes, the better for you as a patient. So time is very important. So early diagnosis of what a medical emergency looks like. We need to train the public and the community on how to recognize that this is a medical emergency. Once they recognize that this is an emergency, then we need to empower them and tell them this is how you call for help, or this is where you call for help, or this is where you go to receive specialized care. The other challenge that we face is that we lack supplies and we lack equipment in the different facilities where we offer this care. There's a shortage and a limitation of specialized equipment and supplies. And in order for us to provide essential care to these patients, we need to have the right tools. But also, we are not enough healthcare providers. Ugandans need to make sure that we can be involved in more training, receive the training, such to become specialized healthcare providers in emergency care, not only for doctors, but for nurses, for paramedics on the ambulance. We need more people to be trained, but we need more people to teach and transfer skills and transfer knowledge. This is very crucial for improving outcomes, especially for the emergency patient. For everyone watching me at home, the take-home message that I want to give you today is that it is important for you at home and everyone who's watching that we learn to prioritize our health. Learn to invest in your health. The same way you have invested in systems around you to protect you and your loved ones, health should be one of them. I'm going to give you some quick tips that can guide you and your loved ones on what to identify and how to identify what a medical emergency is. 1. If you have a difficulty breathing, and this means that you're breathing too fast, you're breathing too slow, you have chest pain, you realize that you're fighting for air, that could be a medical emergency. 2, if you start bleeding in proportions that are catastrophic, or you're bleeding to a point that you get dizzy, you get confused, you cannot stop that bleeding at home, even with pressure or with dressing, then that could be a medical emergency. 3, in the event that someone is unresponsive, that could mean that they are confused, that could mean that they are more sleepy than usual, that could mean that they are not waking up, that could also mean that a baby is not crying as they should be, or it could also mean that someone has uncoordinated movements, some muscle spasms, some movements that just look peculiar. then that could also be a medical emergency. If someone comes to you or someone presents to you and they feel too hot or they feel too cold, that could still be a sign of a medical emergency. Leave alone injury or leave alone trauma, that someone has fallen or someone has had an injury or someone has had a near accident like a drowning incident or has been hit by something, but all these signs could point you towards an emergency. You need to know, who can I call? You need to have a facility that is close to you at your workplace or at your home in the event that you want to avoid delays to receive this specialized care. We've talked about the golden hour. Time is very important. When you get a medical emergency, you need to get to a health facility that's going to offer critical and important interventional care that is specific for your emergency. Have a number with you where you know you can call someone or call a facility to respond to you. The other thing you need to have is an ambulance number. We now have private and government ambulances that can offer a service to you. In the event that you are alone at home, how will you be able to move? You need to know that there are ambulances that you can call that can pick you up and take you to a different facility, or they can take you for specialized care. So please bear in mind all these tips, especially for those that are not familiar with emergency care systems or medical emergencies. Make sure you know how to identify what an emergency is. Make sure you have a contact of a medical personnel that can assist you in an emergency. Make sure that you have some sort of emergency transportation system in place to assist you or your loved ones to take you for specialized care. Thank you very much.
This message is from the Ministry of Health with support from partners.